The lived experience is believed to be at the core of mental health and mental illness practice. The lived experience in mental health and recovery are important because it provides insight into the nature of recovery. The definition of lived experience is the client's first-hand account or perspective. The idea behind lived experience is that no one understands the mental health problem more than the client who experienced it themselves. I like to think of it as similar to an eyewitness in the news who provides the first-hand account of what they witnessed. A reporter who interviews the eyewitness or a therapist who interviews a client will draw on the first-hand account of the lived experience of that individual. Hi, my name is Jeff, and I'm an occupational therapist who makes free content not only on YouTube, but on my website and podcast. Be sure to check out the links in the description. Let's get functional. One unique asset of occupational therapy is the occupational profile. According to the American Occupational Therapy Association, the occupational profile is a summary of a client's occupational history and experiences, also known as lived experience, patterns of daily living, interests, their values, needs, and relevant contexts. This information is obtained from the client's perspective through both formal and informal interview techniques and conversation. You see how the lived experience is baked into the backbone of the occupational profile that you develop with each client? An effective way to gain insight into a client's lived experience is through an interview. This is often conducted during the evaluation. It is often used in research as well, such as through a semi-structured interview. In fact, the lived experience is so important that you will often see the term being used even in titles of research articles and publications. This is not only limited to mental health, but can apply to any aspect of occupational therapy practice. One research article I found was titled, "The Lived Experience of Older Adults, Occupational Adaptation Following a Stroke," or another titled, "Exploring the Lived Experience of Homelessness from an Occupational Perspective." Or how about a study of occupational therapists themselves instead of the clients? One research publication was titled, "The Lived Experience of Becoming an Occupational Therapist." The concept of lived experience is actually part of a research discipline or methodology called phenomenological research or phenomenological approach. The term phenomenology is the approach that focuses on the lived experience of a particular group of individuals. Therefore, you can think of lived experience and phenomenology as synonymous terms. Okay, so now we understand that the lived experience is about the client or the individual or a population even. So how does occupational therapy fit into the picture when it comes to treating clients? Occupational therapy practitioners can use their expertise to collaborate and to help guide others through positive support and interventions. I think in some settings, the lived experience may be easier to embody or understand than others. Mental health may be more difficult than, say, a physical disability, as by nature, I think physical disabilities, it is visible to the occupational therapist. For example, in the study published by the AOTA in 2007 titled "The Lived Experience of Recapturing Self-Care," it mentions that, quote, "Occupational therapists must better understand the lived experience of recapturing self-care and must understand experiences contributing to changes in the self-care training process among people living with the after effects of a stroke or spinal cord injury." This thinking is in keeping with the present study, which has a phenomenological perspective and focuses on the life-world experience of people who have had a stroke or spinal cord injury, who commonly participate in self-care training and who experience a wide variety of activity limitations as well as participation restrictions. End quote. I definitely agree with this statement that occupational therapists must understand the lived experience of clients when it comes to their participation in occupations, such as self-care or ADLs after a stroke or a spinal cord injury. This also applies to pediatrics and mental health conditions, say depression or anxiety or bipolar disorder and so on. Picture yourself working with a client who has had a spinal cord injury and is in rehabilitation to train to get out of bed. The occupational therapy practitioner is literally witnessing and working with the client who is living with the current lived experience of having a physical disability, such as paraplegia, and learning how to get out of bed differently than they were able to before the spinal cord injury. Similarly, an occupational therapist who is leading a CBT or cognitive behavioral group is working with clients who may be going through the lived experience of having symptoms of depression, such as anhedonia, which is defined as the inability to feel pleasure in daily living. This highlights the idea that the lived experience, while often thought of as the past, may also be simultaneously occurring in the present as well. In research, we often analyze data from the past, but in occupational therapy practice, and what's really cool about it is that the lived experience may even be in the present, as you are currently working with your client in different settings, and different interventions, in different populations. The present or current lived experience is unique in that it can be captured differently besides, say, from interviews from events that occurred in the client's past. It can be measured in an assessment, observed, and documented by an occupational therapist. Overall, for the occupational therapy practitioner, understanding and considering the lived experiences of clients can be an effective way to help them meet their goals and to provide a holistic approach to treatment. One thing to keep in mind is that narratives or personal accounts, while very useful, may also be biased, misperceived, or incorrect even. Think about how you try to remember to tell a story from a long-term memory. After a long time, the details may be foggy, and you may insert incorrect details about your past. I definitely have this problem with stories from a long time ago. The same can be true for any individual, but say for a client with mental health conditions, this may be even more of a case. For example, a client who frequently had hallucinations may perceive environmental stimuli differently than what is real or truly occurring. While it is not necessarily the job of the occupational therapist to tease the truth from fiction, using aspects of the lived experience to gain insight into the narratives can be very helpful for practice. So, in conclusion, occupational therapists can gain a lot of insight into the client through their lived experience, both for research and for practice. The lived experience through techniques such as therapeutic listening or interview provides a client-centered approach to practice and for therapeutic intervention. The lived experience may be the past, but it also can be ongoing as the client is recovering and working with the occupational therapist. Therefore, occupational therapy practitioners are in a unique position when they work with clients from all settings at various stages of their recovery as they learn about and help clients shape their lived or living experience through recovery and rehabilitation. Overall, occupational therapy practitioners can promote hope, empowerment, self-determination, and help clients to achieve their goals through insight into their lived experiences together. Hope this video helps. Be sure to subscribe to this channel for more occupational therapy content. My name is Jeff, the OT Dude. Thanks for watching and have a nice day.